Welcome, friends. I'm your host, Sharat, and welcome back to another glorious episode of Health and Healing with Dr. Saraswathi Kalvakota. Yet again, we're going to embark into the wonderful land of well being, where we'll discuss a lot of wonderful topics which will discard all your problems and all your doubts and surmises about what is going to happen in your body. And we'll give clear cut solutions for a lot of ailments, a lot of things you have to follow, a lot of strict regimens, and some wonderful tips by Dr. Saraswathi. And you know Dr. Saraswathi very well. She doesn't need any introduction. She has expounded a lot of lovely topics like diabetes management, heart health, post-COVID syndrome, and she's going to discuss many other topics. But today's topic is a global medical emergency called monkeypox. So before that, let me welcome Dr. Saraswathi. Dr. Saraswathi, welcome to our show called Health and Healing. How are you doing today?
I'm doing very good. Thank you, Sharat. And again, I'm really pleased to be giving another talk on health and healing series and with Mana TV International Media. And I'm really proud that, we have covered a few sessions in the past. So today's session, as you said, it is going to be monkeypox. This is something which we have not heard about this disease for a long time because it was limited to certain areas in Africa. So now we got the monkeypox has got the attention as we are seeing this monkeypox is spreading to other countries gradually. So it is our responsibility for the health care people to educate our audience and the public so that they can get the awareness and education about this entity so that you can stay ahead of all the problems which may come with the monkeypox, and so that you will continue to enjoy healthy life and productive life.
Thank you again, Dr. Saraswathi. You've always been instrumental, in clearing so many doubts of our audience, of our Mana TV International audience, have been benefiting from your lovely suggestions, your tidbits, your tips and tricks to, heal our inner selves and, to come to a sort of balance, which we have kind of lost, kind of after the pandemic, but we're coping with the stresses and anxieties. We have covered that topic as well, stress and anxiety. So we have kind of come a bit far in the field of health and healing. And, there are many wildcard entries like monkeypox and so many other things. I know you're going to discuss about other things as well. I want to know, for my sake and for our Mana TV International audience, what is this monkeypox and what are the different types, and what is the a coherent relationship, if any, between monkeypox and smallpox virus?
Okay, that's a good beginning, and we will start with a few detailed points and statements. Monkeypox is very much limited, or used to be limited, to that place in West Africa. So, as I said, that it is spreading to other countries. And it's not like COVID-19. It is spreading like a wildfire. It is spreading slowly and gradually. So for that reason, we are bringing this topic again. So this monkeypox is a DNA virus, means it incorporates into the DNA of us, and then it multiplies. And that's why it is called DNA virus. And also it is pretty much similar to smallpox, if you have ever heard, that was eradicated in 1970. So that virus and this virus are like a twins or sisters. So there is a difference though. Smallpox virus was at that time killed millions of people, and we never saw monkeypox at that time. So at this time when the smallpox were eradicated, everybody got immunized at that time, so monkeypox never showed up. Since 1980, the monkeypox has lost. It remained virulent, but it has we as humans did not get protection, because smallpox vaccine was equally effective to monkeypox vaccine. So ever since we stopped giving smallpox vaccination, monkeypox surged. That started in 1980. So that's the relationship with smallpox and monkeypox. They're sisters, but they behave different. So there are two types of monkeypox. One is very much widely infectious, or commonly or easily, quickly it spreads. That is called West African virus. And this virus spreads very quickly, but it's a very milder form of monkeypox. So you see, it spreads quickly, but it's a milder form. The second type of monkeypox, which is very prevalent in Republic of Congo, it is also has the affinity to spread quickly, but it's a lot more severe form of monkeypox. So fortunately, what is spreading rapidly in the world is the one which is type 1 in West Africa. So gradually it spread to East Africa, West Africa, South Africa, and then it spread to UK, and then it spreads to Australia, it spread to the other countries, Canada and USA and all that. So this is the relationship.
Thank you again, Dr. Saraswathi. Your answers are, definitely, though the subject is complex, you ease around things, you simplify things. Thanks for the kind of simplicity you bring to the audience in the layman's language. I mean, you bring the cryptic medical health terminologies to, and then simplify them, cut them short and give it wonderfully to our Mana TV International audience. And it was as well funny to hear that, this monkeypox is the sister of smallpox. I know it is definitely, as you said, it is more virulent than smallpox. Absolutely, pun intended. I just want to, wanted to make humor around that, but I know it is a burning issue, as well as I mentioned it is a global medical emergency. So I plunge into my next question. So tell our Mana TV International audience, what is the source of this monkeypox virus, and why this disease was so uncommon in the past, and why is it spreading globally now?
It's a very interesting question. And we have done a lot of work in this area. Means the CDC, World Health Organization, has been, they have been working hard in these areas to see how this is doing, how this is getting infected, and why it is spreading now. Actually, the incidence in USA now, as of August of 2022, they detected 17,000 cases in this country. And then to the surprise in the whole world, they have already reported 40,000 cases of monkeypox. And there is a slow growth. It is progressing and increasing. It has not plateaued yet. It has not declined in the bell curve. So we are concerned because it has not plateaued, and we already have 40,000 cases in the world. I mean, it may not sound like COVID-19 millions are affected, but this itself is a concern for the public and World Health Organization. So we need to tackle this in a much quicker way, and so that we stop it right in the beginning. So coming to that, how it is transmitted. Primarily, it used to be a virus which was a reservoir in the monkeys, and they are the host. Now, the monkeys and humans are getting more in contact with each other. There is now a surge in the spread of certain viruses from monkeys to humans. So that's the root cause. And before, animals had their own wild forest, and they never had to come out and be in contact with humans. So the ecology system has changed. So we are seeing animals coming in contact with the human beings. And which animals are hosts? Mostly it is reported that rodents have are the hosts. They harbor the virus. And then after rodents, squirrels, and there are certain type of squirrels. They also have the virus. And then also there are another animal called perpicuans. This is another type of animal. And these are the animals which have the virus. And the monkeys carry this virus through them because they also live with them. So the monkeys carry that. Many monkeys are kind of come in contact with the humans. And in 1980s, these monkeys were shipped to Singapore. This is a real story. Monkeys were shipped to Singapore, and the monkeys had that virus. And then they were shipped to Ghana. And then that's where these monkeys gave to the squirrels. They are called prairie dog pets. They were so cute, and squirrels, people fell in love with them. So they started adopting them. They started having as pet animals. And as soon as we found out that there is an animal which is cute looking, which is a small size, the United States start transporting and getting those squirrels from Ghana. And then a lot of people had pets, grew them as pets. And immediately in 2003, they found Americans they reported few cases of monkeypox. And immediately CDC banned those animals as pets. So it subsided. Then again, 2017 onwards, they started seeing the surge of monkeypox sporadically here and there and here and there. And with the increased global transport, humans being going on everywhere, and there is an ecosystem changing. These viruses lived very well with these reservoirs. And then humans became the reservoirs too. And that's how the disease started expressing their clinical expression seen since 2017. So by 2022, we already reported these cases. So you see how the story of this little monkeypox virus has traveled the whole world. And now it is becoming human problem now, human disease. If these animals to be left alone in their own forest, at their own place, we wouldn't have had this disease. So this is the story of this. And I think there are other things where we need to really know that this disease comes only when you have a direct contact, skin to skin contact with people. And that's one. And if you are closely breathing from each other, that's another contact. And then if you are in contact with people who have the disease, and then they need to wash their clothes. They need to wash everything very carefully every day, and they need to be isolated so that the other person doesn't get the disease. So these are things are found that how we can eliminate the spread. And the last but not least, pregnant women can have the monkeypox, and they can also transmit to the infants, and then they can get the disease too. So these are several ways the disease is transmitted. This is all we know about it. Rodents seems to be the major source of harboring this virus. So
thank you so much, Dr. Saraswathi. I mean, I didn't know that there was such a big history of how it traveled from one country to the other, and finally it came to the United States of America, and still globally prevalent and spreading. And it's a big number, 47,000, reported across the globe. Definitely, it is alarming. Thank you for giving us the statistics. So, without any further ado, I'll ask you the next question. Our Mana TV international audience are curious to know what are the symptoms of this virus and how to recognize them early on, and how do you identify it from the usual flu or viral infections or viral fever, so that we can take proactive steps.
I think that's a very relevant and important information we are going to talk, or we're going to discuss about this disease, because we really want to know how to recognize this problem. And it's a very intelligent question, and it's a very it needs to be answered very appropriately. So in a simple way that you will catch my message. That's my goal. This disease has two phases. So sometimes these two phases can merge and then become like one phase and then have the disease throughout. Usually it goes through two phases. What is the first phase? It's like any flu-like symptoms: sore throat, fever, and not feeling well, fatigue, chills, and lymph gland enlargement, lymph node in the axillary as well as in the throat and neck, and also other areas. That's lymph node enlargement is also one of the criteria in this phase 1 stage. So these are very mild cold-like symptoms. Winter, when we go through the winter cold, these are the things we go through, headaches. So that is first phase. You will never know that this is a monkeypox in that phase. After 3 or 4 days, you start seeing a rash, skin rash. So that skin rash can appear after 3 days, or it can appear along with these symptoms. So it can happen both ways. This is what it's going to differentiate monkeypox from other flu-like symptoms. What happens with this skin rash? It's very classic. Punctate, raised lesions come up, and then they become like a vesicles. They start collecting the fluid, and then they start having major, big size, and they can be 10 skin lesions pop up, 1,000 lesions can pop up. The slide you'll be seeing while I'm discussing, it will show how those lesions look like. And these lesions are highly infectious. And this person, as soon as you see, this person needs to be isolated 100%. And we should not let this person mix in the house and touch the objects, touch the things which are being used by normal people in the house. So these are the symptoms, phase 1 and phase 2. And these skin lesions can appear on the hands, it can appear on the back, the chest, in the groin, and in the private areas, and also on the legs. So what happens when it is seen in the private areas, they will have problems in the problems of lesions, skin lesions, and infection in the rectal area, that's called proctitis. They can also have problems with the urinary problems, urinary retention or from burning, because they are close to the area where we are using for urination. So these are all the symptoms which which you put together. There is no doubt that you are dealing with the monkeypox virus.
Thank you, Dr. Saraswathi. Thank you for explaining us the symptoms, and at what parts of the body you can actually spot them, and what happens, and how do you distinguish between the flu and monkeypox. Just wanted to, on that note, again, another question for our Mana TV International audience I'm posing for you is, tell us who are at risk for this monkeypox and how to identify them, the people, and how long this disease lasts, once an individual is infected, and what are the complications if they are minor or major. Please tell our Mana TV International audience.
Yes, I think these are all relevant questions, and I think we need to really have the clarity in our mind. It has its own complications, but let me tell you, majority of them get better. Maybe 1% to 2% of them can have problems. Having said that, there are people who can get the disease first, and then also it can linger for a longer time. The disease, for a normal people who get this, it lasts for 2 to 4 weeks, and then everything gets resolved and they're back to work and functioning normally. People who have immunological problems, they are, some of the immunological related diseases, autoimmune diseases, and most important, people who are HIV positive. And these are the people, there is a higher incidence of monkeypox disease, and also to give the number for HIV patients who get this disease is 38%. That means it's a very high number. They are at the highest risk for developing this disease. So those are the people at high risk. Now coming to complications, as I said, again, many people, majority of them get better, but there are few complications can happen. They can have pneumonia. They can have pleural effusions, fluid buildup in the lungs. They can have meningitis or encephalitis that can affect the brain and make them confused, and then they may run into encephalitis phase for a few days. And some of them who are immune compromised, they may take even longer time. Encephalitis is the disease of the brain, infection of the brain, where it takes longer time to heal. So that's also can leave some morbidity, some incapacity in the patients can get incapacitated later on. So that's the one area, morbidity, including pneumonia. It can lead some problems. And also they can have a sepsis. Sepsis means the virus can infect every organ in the body, and then they become septic. Septic, and the whole body can become septic, and they take long time to heal. So these are the certain complications we come across with these people. Again, I'm emphasizing that majority of them, they get better. So having said that, we also want to cover some of the complications of that.
Thank you, Dr. Saraswathi. Tell us, what are those diagnostic tests or the confirmatory tests to confirm the presence of monkeypox in the individual, and where these tests are Where are those physical locations where these tests are available for public or people at large?
Yes, we do have tests. And this virus is detectable in the blood when you draw blood, and it can be detected. And also through PCR testing, it can be detected from the skin lesions. And also it can be grown in the culture, that the virus can be grown in the culture. There is a caveat here. What is that? They are not available in the regular laboratories we have in this country. There are two reasons for that. Number one, the number of those test devices are not available to collect the specimens in this country. There are located in CDC, and wherever the disease is occurring in those particular regions, this equipment is sent, like tubes and cotton swabs and other liquids which are sitting in the tube. They're particular way it is collected. So they are available to those where there is needed most. We are getting a big supply, I think, from Denmark pretty soon to supply a larger population. And I'm hoping that we do not have to use it. But right now, it is limited to people at limited population, those who are high risk, like HIV patients and autoimmune problems who have. And those are the people who have a high propensity for the disease. So they are provided these things. And they also are provided other preventive measures. And I will talk to you, soon on that regard. So that is the test. It is available, but it's not available for everybody.
Who is eligible for those medications, and who are, especially for the people who are immunologically compromised, they are given the maximum amount of care. Otherwise, I'm proceeding to my next question. I want to juxtapose my doubt per se, because if others have a good immune system, but still they're prone to this, and to avoid the discomfort of having the disease. Tell us, what are those preventive and protective measures one should follow for monkeypox disease, so that they can actually circumvent any inception of the virus in the body?
Okay, so first thing is avoid contact with persons who have the disease. Take all the precautions to be away from that disease. That's the best way to prevent infection. Second one, try to keep disinfectants ready and clean the surfaces, tables, everywhere, if you suspect that the person lived in that place. The reason is, to our surprise, the virus can live on the surfaces for 15 days. So it has to be disinfected on a daily basis, so you do not have this virus. Others cannot get this, number one. Number two, the third one is, please remember, it's not an airborne disease. Like, you are standing close to a person, like 3 feet away, 4 feet away, 2 feet away, you're not going to get the disease. Only when you touch the person, come very close to the face, then you get the disease. That's why it is not called airborne disease. So that's a point we should know. So, don't get scared going 1 mile away from the patient. You can be there, but at the same time, keep a distance, not touching the patient. So that's the whole idea. And avoid people who come in close contact. People who have multiple sexual partners, Now, you must avoid those people because, again, sexual contact is one way this can cause, and this can come and spread the disease. And that's a very important point, and CDC recommends highly about that. Wear personal protective equipment. If you are very close to the person, or if he's a relative and he has to live in the house, or if this person is hospitalized. What is that PPE? It is like wearing the gloves, wearing the mask, wearing the gowns, and washing the hands before and after touching the patient. These are the PPEs which have to be followed very strictly. And also, these equipments have to be disposed of also very properly. You can't just use a gown and come and put it in a regular trash. It has to be disposed of properly too, because the trash will have other things and somebody is picking up the trash, the individual can get it. So that is another thing. Make sure that the person who has the skin lesions covers them with a cloth so that they do not become a source of infection. So those lesions have to be covered properly. That's for the safety of the other persons. And other thing I would think of is when you wear the mask, it has to be well-fitted mask.
Just through the preventive measures of this global medical emergency, which is monkeypox. I wanted to emphasize that because people should understand its preponderance rather. So just want to ask you, what are those? Are there any oral medications or drugs available in the market? And what is the role of this? Is there any vaccination, and what is the role of this vaccination for monkeypox and the guidelines, prevention? And I've been doing a bit of reading about monkeypox, so I'll ask a bit of your jargon about what is pre and post exposure prophylaxis. So if you can again unravel the answers to these questions, I'm very sure Mana TV international audience will be benefited.
Very relevant question, and this is the crux of the matter. How can we prevent? How can we prevent when you are exposed to the disease? How can you prevent after exposure is over? So there are few guidelines CDC has provided us. Tecovirimet is a tablet, is a tablet available for monkeypox. It has gone through all the research. However, it's not available in this country because FDA has not approved it. So we cannot give the tablet so far yet. Now, coming to the next question, vaccinations. Who gets vaccinated? We do not have a clear picture that everybody should be vaccinated. It's not like a COVID-19. We have to know that. And majority of monkeypox are limited to close contacts. The disease limits to close contact. So we have a framework where we can reach those people who are going to be affected. First person who has the disease, they have a ring form of doing vaccinations. What is that? The person who is closely affected, closely in contact with the person who has the disease, gets vaccinated first. And that person who gets vaccinated, he comes in contact with 2 other people or 3 other people, right? Those people get vaccination too. So you immediately, you cover like a circle. You immediately cover that group of people with vaccination. And majority of them, once they get the vaccination, they won't get the disease. So it spreads like the vaccination goes like a ring. So wherever there is a potential exposure, they immediately get the vaccination. So that is called ring vaccination. And these vaccinations are two types. One is called Genneous. That's the Jenneous. It's a one type of vaccination available in this country. And this is a vaccination which is modified and seasoned by another vaccination which used to be given for smallpox. Now, I mentioned just a few minutes ago that smallpox vaccination stopped monkeypox. So, but that smallpox vaccination had a lot of side effects. I remember taking smallpox vaccination as a child. It took me 15 days for the skin lesion to heal. So majority in many countries, they took the vaccination. That is a smallpox vaccination, which had bad side effects, but they were protected from the disease. The Genneous, which came just now, is as effective like other smallpox vaccine, but it has very few side effects. That's why it became popular. So that vaccine is effective and it is given like a ring vaccination. So they go through the ring pattern of protecting these people who are exposed to. So that is the way the vaccination is given. Now, the other one also is called immunoglobulin. It's called vaccine immunoglobulin. Those who are already exposed and they didn't know that they may get the disease, it's a generic time. Like, you have the immune antibodies, in your blood, and then, you get that to that person. So he will be temporarily protected. So these are the three types of vaccination, but majority now is a Genneous, which is available and which is effective for these patients. So that's about the vaccination and prevention. And coming to when you take the vaccination, if a person is exposed to a person who has disease, he should be getting it within 14 days after he's exposed, preferably within a week, but within 14 days. So that's the way it is recommended from CDC. Now, how long the disease goes or lasts, it is like almost 2 to 4 weeks the disease can go on before people can start recovering from it. So 2 to 4 weeks is the period. And so those who are exposed, they should get it within 15 days. And those who never got exposed, but they have a higher potential, they should get vaccinated right away. They are higher risk, they should get vaccinated. And only those two categories we have, and the vaccinations are given. I think we hit the vaccination protocol from Sharad.
We are almost, at the end of our session, and I mean, you have very beautifully elucidated, the statistics of, how many people are afflicted, the preventive measures, the diagnostic and confirmatory tests, and the kind of vaccinations and the oral drugs, and how you can assess yourself and what kind of risks you are posed with, or your near and dear ones, your family members. This knowledge is vital because without these, people definitely have a lot of apprehensions, because this is though this has been, you've given the history of monkeypox, but pretty much a lot of us are in dark. So I thank you for that. But before leaving, just give our Money TV International audience some take-home messages about this virulent virus, monkeypox, and if you can, if you can give us a bit more, to conclude, so that all of us can get benefited.
All right. So what did we learn from this whole session? And I'm asked to make it a small synopsis. I think this is difficult, but I will try. Let's do it. What did we learn? We learned that an endemic disease has been spreading to the world. So time has come to take precautions and work on it. Number one. We learned also how it presents. When do we have to be concerned when the skin lesions start popping up? They look like so many other lesions, so many other diseases, but we have to narrow it down to as a monkeypox lesion. And that comes only when you associate with the phase 1 part of the symptoms, and phase 2 appears a little later or at the same time. So we learned how it presents. And we also learned there are high-risk people who are in close contact with each other, intimate contact with each other. They can have they are at higher risk for that. We also learned that there is a vaccination available to those high-risk people, or where there is a increased surge in that particular region in the population, that they can get vaccinated, protect from the disease. So we also learned that the tablets, which we are hoping it will come, is there, but it has to be approved by FDA. So with all that,
fingers crossed,
we know that the CDC is working intensely with us by doing so many studies, accumulating the world data, and sending every patient to CDC who has a monkeypox. And they are doing all the statistics and data and research. So we will know up-to-date information from CDC. So I encourage all of you to follow up every often. What is the new thing coming up with the monkeypox? We hope it is going to be over. We hope it, the way it is there, it has not come down to the bell curve yet. So we are hoping that it will come down towards the lower, descending type form, descending line on the bell curve. So we don't have to deal with this disease again. Once again, I'm concluding at this synopsis, and I hope these are the very important points for you to take home. And thank you. We'll see you next week with another topic.
Thank you again. I'm really grateful to you, Dr. Saraswathi. Beautifully taken your time to explain, answer all my questions, and as well given our Money TV International audience a surprise gift, that is a synopsis for how to understand, and what are those guidelines in between. They don't digress and understand where they are at, and help other people as well. Definitely this the whole package of this whole session, this episode, I'm very sure will be instrumental to somebody somewhere across the globe. Thank you so much once again. Our heartfelt gratitude from Money TV International as well. So friends, that was Dr. Saraswathi Kalvakota talking about this global medical emergency called monkeypox. She beautifully explained everything, including the synopsis. I'm very sure that you're going to take away a lot of pointers, a lot of tips and tricks, as I already told, and keep yourself safe and healthy. Take the tips and suggestions given by Dr. Saraswathi very seriously. Definitely we'll meet next week with another topic, with another enlightening topic in our series called Health and Healing. Until then, please don't forget to subscribe to our YouTube channel, Mana TV, and as well our Facebook channel, Mana TV. Keep watching our health and healing series, and keep writing to us at my email, sharat@manatv.net. That is SHARAT at manatv.net. And love to see your questions. And Dr. Saraswathi Kalvakota would be glad to answer those questions. We'll write back to you, or maybe we'll do another session about that. Until then, your host, Sharat. Thank you.